All right, so good morning and good afternoon, the participants. Welcome back to the study group. We'll be discussing the last 5 months of review. I picked 1 or 2 pages from each chapter presentation, and then we'll discuss as part of the reminder. This discussion will be recorded, and you can listen at the end. Participation is greatly appreciated. For today, I would like you to use as much as you can, only in English. If you are in doubt, you can use Amharic, because the test is going to come in English, not in Amharic, Oromiya, or Tigrinya. So try to introduce yourself before you answer the question, especially about what you're doing, what are your plans, and when you are going to take the test. So I'll be asking each one of you. If you are not interested, you can just stay quiet. Otherwise, it will be coming just in the middle of the presentation. So the first one is about fundamentals of nursing. You'll be asked a lot of questions about what is the responsibility of LPNs and RNs. There are different job descriptions. One of them is unlicensed assisted personnel, which is not a nurse, but somebody trained for 3 months to help for hygiene, for transport. Sometimes they can do vital signs when the vital signs are already stable, like doing blood pressure in the morning, afternoon, evening can be done by unlicensed person. But if the blood pressure is low or high, unstable, they should not do it. Next one is LPN. LPN is licensed practicing nurse. They are not like registered nurses, but they can do many things what a nurse can do, but they cannot do IV treatment, blood transfusion, initial admission, evaluation, initial teaching, and they cannot do even discharge instruction. So the first question goes to Tegest. So Tegest, I would like you to tell me what's the difference between LPN and RN.
Thank you, everyone. Good afternoon and good morning. Let me introduce myself first, and I will go to the questions. My name is Tegest Lemma, born in Addis Ababa. I'm married and a mother of 2. Graduated in clinical nursing from Jumma Institute of Health Science in diploma, and then I have got my BSc degree from Hayat Medical College. I have been working in different medical centers. Currently, I am working at Hamlin Fistula Hospital as a head nurse of a stomach clinic for the last 13 years. Started reading and participating in this forum, Mazi staffing Nclex and Aidan's Nclex Natna group in Telegram for the last 6 months, which is really wonderful platforms. I really appreciate and would like to thank and bless Maazi and Dr. Azano for their unlimited help and guidance in each and every direction of our success. Every day, I sit 3 hours for preparation. I am using a source materials like Sounders. From YouTube, I am listening Registered Nurse Sarah, Level Up RN, and Simple Nursing. Recently, I started using URLs for questions. I got it very helpful and I really like it. I did all the process. After 5 months, I will take my Nclex exam. Thank you for listening to me. When I came to the question, let me start from the name stands for. RN means registered nurse, LPN, licensed practical nurse, LVN, licensed vocational nurse, UAP, unlicensed assistive personnel. Both LPN and LVN perform same activities. When I came to the scope of the practice, registered nurse can do clinical assessment, initial clinical client education, discharge education, clinical judgment, initiating blood transfusion. LPN and LPN or LVN, that means licensed practical nurses, should be assigned stable clients with expected outcomes. They can do teaching reinforcement. They can administer anticoagulant medications. They can suction. They can perform sterile procedures like catheterizations. They can auscultate lung sounds, but cannot use that information to evaluate. They can monitor RN findings. They can monitor for bleedings. They can maintain an IV and document the flow. They can do tube feedings, but not the first. They can change the dressings, but not the first. And when they don't perform, I will come to what they can't perform the procedures. I will list down now. They cannot perform initial teaching, assessment, or evaluate a client's condition. They cannot start an IV, hang or mix IV medications, push IV medications. They cannot plan care. The LPN can implement it, but they cannot plan the care. They cannot perform or develop teaching. They can reinforce it, but they cannot perform or developing teaching. They cannot take care of unstable patients. They cannot do the first thing of anything, like admission. They cannot do admission, discharge, transfer, or the first assessment after a change. Also, they cannot administer or monitor blood transfusion products.
All right. So you are all hired, so you did 100%, so you don't have to do more. You are really good. So you need to expect you'll be asked a similar question once you finish your Nclex. The hiring people may call you. They may do the same interview what I said. It's very good. Do it that way. Usually making it a little bit shorter is better, but you are more than perfect. That's very good. So when we go to the next slide, it's about SBAR. SBAR is abbreviation for how to call a physician when there is a need. S is situation, B is background, A is for assessment, R is for recommendation. As I said before, nurses should think like doctors because there is a big responsibility. There will be a big expectation about the knowledge. Let's say you have a patient who has fever and you want the physician to come and see him. You don't call and say, oh, your patient has fever, come. No, this is how you do it. You call and you call the right person. So you would say, hi, this is Tegest, the nurse on the 5th floor, calling you about the fever and abdominal pain on your patient. Are you Dr. Johnson? He would say, yes. So your patient in 588, he was admitted 3 days ago for a hip fracture. He has a hip replacement. Now he has a temperature of 39.8. I think he has pneumonia because he's breathing fast, his vital sign, blah, blah. And then you finish and say, I would like you to come and see him, order x-ray and do blood test, and he may need antibiotics. So you are speaking the doctor's language. So this is an expectation from a nurse. It's called SBAR. You have to say the situation. This is fever and tachypnea. In the background, you tell the right patient, the right room, because the patient might have a similar name with another person. So you should not mix patients and rooms. So you have to identify the right patient. That's the background. Your assessment, you have to say the diagnosis. It's a nursing diagnosis. You could say, I think he has pneumonia. And you have to put a recommendation, say, calm down, see him, and do x-ray. It's a suggestion. It's not a command. So that's called SUBAR. Any question on this? So the next one is how to do injection. So anyone who took Nclex class, Nclex testing before told me that it looks easy, but they get confused and they don't think they made it through. So when there is intramuscular injection, the needle goes straight 90 degrees to the skin. Subcutaneous, around 45 degrees. When it's intradermal, it's around 10 to 15 degrees. It's not only the angle, you have to look into what layer the end of the needle is. Because the top one, the pink one, is the skin, the yellow one is the fat, and the red one is the muscle. So intramuscular should go down all the way to the red. Subcutaneous, it goes to the yellow, the fat. And intradermal, it goes only to the pink. Because they will not tell you which part is a muscle, which one is subcutaneous, which one is the skin. They will give you only the picture, no writing. So if they put the angle to 10 degree, but it goes down to the muscle, it's not intradermal. It's not intramuscular. So you have to look into both the angle and the layer when the needle goes down. It's not only that, they will ask you specific drugs. Like the last question Melat got was, patient was getting vaccination. It was a child. So which one do you pick? So which one is it going to be? That 90 degree going to the muscle, or the 25 degree going to the subcu for vaccination? So it will be intramuscular. So it will be 90 degree, should go down all the way to the red one, which is a muscle. Insulin, it will be 45 degrees. It goes to the yellow or the subcu. If it is Lovenox, same thing. Vancomycin, it goes to IV. PPD, it goes to the skin, intradermal. Any question on this? All right, so next one is degenerative disease. We discussed during a neurology discussion. You need to know about Parkinson's disease, Alzheimer's disease, multiple sclerosis, myasthenia gravis. Once you know what's the pathology, it's easy to know the rest of the story. In Parkinson's disease, the dopamine level gets low in the substantia nigra. Patients get stiffness, tremor, they fall down, and they get hallucinations and all that. In Alzheimer's disease, their memory, especially in the hippocampus, get affected because of low acetylcholine. So you have to increase the acetylcholine level. Multiple sclerosis is very important. In the northern and southern hemisphere, there are so many patients with middle age, especially women. They get eye problems, nerve problems, contractures, urinary constipation, all these problems because the sheath of the nerve is affected. It's called the myelin sheath. Myasthenia gravis, remember, the problem is in the postsynaptic area. the acetylcholine receptors are affected by antibodies, so the person gets weak. So that's where myasthenia gravis is. All right, so the question goes to Joseph. Is Joseph around? So Joseph will be the next person. Introduce yourself and tell me what I said about degenerative nerve disease. All right, so Joseph is not around, so we'll pass it. So next slide is about nervous system drugs, especially anti-seizure medications. You'll be asked, the patient has all these rashes covering many areas, including the buccal mucosa, the lips, or the eye. And in the story, they may tell you patient is on these medications for seizures, especially phenytoin, carbamazepine, phenobarb, lamotrigine, and even patients on allopurinol get Stevens-Johnson syndrome. It's very serious illness. It can affect large areas of the skin. If it is less than 10%, it's called Stevens-Johnson. If it is more than 30%, it's called toxic epidermal necrolysis. It's very important. It may come in different ways on your test. It may say which patient is a priority, because this type of situations are a priority because they get dehydrated, because so much skin is affected, they lose too much fluid. They could get infection. So they should be treated with serious caution. They should be treated like burn patients. If you have any question, you can stop me anytime. One time we discussed about next generation questions. Next generation questions are like cases. There will be a follow-up story, a follow-up question. There may be like 6 or 7 pages on one case. We discussed about congestive heart failure, DKA management, alcohol withdrawal, COPD exacerbation. We talk about stroke, septic shock. So what's important is not getting frustrated. Let's say if it is a heart failure patient, they may put so many words on the introductory part about the chief complaint, history of present illness, medication. There may be so many words. So you should not get frustrated. Start with the chief complaint. They may say shortness of breath. And when you look into them, you may find weight gain, edema, orthopnea, all that. It will give you the clue. It's not like for frustration, it's just for helping you. So when you look into all that story, you should highlight what's important and what's not important. So rather than getting frustrated, just look into what's the important word. So you have to mark in yellow in the story, and that will be counted as more points for you. So when you see more paragraph, more sentence, it's good for you. It's giving you more clues. In the meantime, you have to think of what else could it be? Differential diagnosis. Does it look like COPD? Does it look like pneumonia? Does it look like pulmonary embolism or something? And if you have the clue, it will be easy to pick what the diagnosis is. If it is heart failure, you have to make sure the plan is to get rid of more fluid, so Lasix, diuretic. And what do you expect? Weight loss, improvement in breathing, and what do you do on discharge? You teach them about water restriction, weight gain, instructions, follow up with primary doctor, and all that. It's so easy if you don't get frustrated. If you get in panic, you lose everything. Similarly for DKA, the patient may come with weakness, fever, or tiredness. And then without knowing in the history, you may get some clues like it may tell you acetone like breath or rotten fruit type of smell, which is DKA. And they will ask you, what do you do next? Check glucose. What do you do next? Put IV line for what? IV fluid, and then blood test to check the anion gap, the bicarb, the potassium, and all that. And after that, insulin drip. And what do you expect? Glucose will improve, the patient will get better, blood pressure improve. Everything follows one over the other, so don't get frustrated. Same thing with alcohol withdrawal, COPD exacerbation. In COPD exacerbation, what's important is they come with coughing, wheezing, maybe with hypoxia. They need nebulizer treatments like albuterol, ipratropium nebulizer frequently, and then they can benefit from steroid, IV solimedrol. That may make the glucose high. So that will be even part of the question. But what's important is just look into some clues and use that. On discharge, don't forget to counsel for smoking cessation. Sorry, so smoking cessation counseling is very important for any case, whether it is stroke, whether it's heart failure, pneumonia, COPD. It's very important. You get extra points just for doing that. In stroke, what's important is to do more things right away. Number one, follow up with ABC rule. Jumping to the diagnosis is not important, but making sure patient is safe, like airway, is the oxygenation okay, is the circulation okay, blood pressure okay, is mentation okay. If the patient is totally obtunded, they would rather benefit from intubation than CT scan or thrombolytic. So always follow up with ABC rule. That rule follows for every diagnosis, whether it's DKA, even a DKA patient may need ventilator first, because if the oxygen is low, the patient will die before you treat the hyperglycemia. Same thing with sepsis, anything, COPD, even alcohol withdrawal, all ABC rule for applies. In stroke, CT scan should be done quick to make sure there's no bleeding. If there's no bleeding, patient may benefit from thrombolytic. It's important. In sepsis, it's very important to do ABC rules and IV line, IV fluid, blood draws, antibiotic, pressure, steroids are very important in the order. Any question on this? I'm just going through to remind you what we discussed before. All right. Next one is substances with use disorder. We discussed it during psychiatry discussion. Substance, unnecessary substance. Some of them are prescription, some of them are not. The person sniffing through the nose, that's cocaine. That was the one that stimulates so much. So the person will be excited, will have a lot of energy. But keep in mind that substance can perforate the septum of the nose. If a patient has perforated septum, that person may be using cocaine. Opium plant is a source for opioids, morphine, methadone, and all that processed opioids. Important is the heroin. The heroin is given in IV. Why is it important? because people share needles. When they share needles, they get HIV, hepatitis C, they get Staphylococcus aureus infection, they get endocarditis. You can make like hundreds of questions just because of the IV drug injection. So many things can happen with IV heroin use. You can be asked like, if a patient is on discharge and asking diabetic syringe so he can use heroin, do you say yes or no? The answer is yes. You give him needles, doctors write prescriptions, or pharmacists can give free needles so they can use drugs. Why? Otherwise, they share the needle and they could create public problems of increased hepatitis C infection, HIV, and other problems. So it's better to give them the needles than to say no. It's called needle exchange program. Any question on this? يوسف يسمعك؟ فردوس يسمعك؟ تقدر تسمعك؟
يسمع.
All right. The next one is reminder about side effects of psychiatry medications. ADHD is hyper, but it's treated with a hyper medication. I don't know why, but it works. So amphetamines, methylphenidate, they increase blood pressure, hypertension, especially in people who are using over-the-counter medications like cough medications. The additive will be too much high blood pressure. It's called hypertensive crisis. So remind that. Clozapine, you'll get so many ways of questions on clozapine. It's a mood disorder, antipsychotic medication. It's known by decreasing WBC. It's called leukopenia, and they get fever. So the question will come that which patient needs a priority? Patient in the third floor with fever on clozapine, or the patient on the blah, blah, blah. So they always make it as a priority. I saw many patients. I still have many patients on clozapine. We check blood tests all the time, but I didn't see any leukopenia. But it comes often on the question. So clozapine, CBCC, you can remember it as CBC. WBC will be low, and it's important to know. Olanzapine is an antipsychotic medication. It's known by metabolic syndrome like obesity and hypercholesterolemia and all that. So, obesity, just it's very important. Bupropion is one of the good medications for depression because it has less sexual side effect, because they like this question because many patients will be non-compliant because of the sexual side effects on other medications. But it's known to create seizure. The other one is MAO inhibitors, monoamine oxidase inhibitor drugs. For example, seleglin, they increase blood pressure, especially with other medications. And tyramine source foods like cheese, raisin, if both medications or the medication and foods are given, they get into hypertensive crisis. Blood pressure will be very high. The other one is SSRIs, serotonin receptor reuptake inhibitors for depression. If they are given together or high dose, or a similar medication like herbal medication like St. John wort, they will get too much serotonin. They get into a situation called serotonin syndrome. Any question on this? All right. So next one is on ABG. So I would like Asmait to introduce herself and repeat what I say on arterial blood gas. So this was on the critical care discussion we had before. It looks like it's not a nursing thing, but it will come on your nursing test. So bear in mind, you have to know about arterial blood gas. So the blood is drawn from the radial artery, and when the blood is drawn, you have to make sure the ulnar artery is patent. So there will be a test to know if the ulnar artery is working or not, because if the ulnar artery is not working and during the blood draw to the radial artery is affected, so the person could lose the hand. So you have to know how to check if the ulnar artery is working or not. Once the blood is drawn, it goes to the lab or to the meter and then get processed. The machine will give you a report about the pH, PO2, PCO2, and the bicarb and all that. So based on that report, you can guess what type of acid-base disorder it is. So I'll give you in the very easy way. One way to know is the first line has a low pH, which is acidosis, and high CO2. So it's very clear the acidosis is because high CO2. High CO2 is because of low respiration. It's called respiratory acidosis. So it's always good to know only this one, and then the rest follows. Because on your test, you'll be very, very confused when you get all this metabolic acidosis, respiratory acidosis, metabolic alkalosis, respiratory alkalosis. So many words jumbling each other. So it's better to know respiratory acidosis, like severe COPD, or patient is comatose, cannot breathe out the CO2, and the body gets acidotic. If you know this, I think you can answer the rest of the questions. So the next one is pH is high. pH is high means alkalosis, and PCO2 is low. So why is the person alkalotic? Because the person is breathing fast, like panic attack or mountain sickness. The person is breathing fast, and the body is alkalotic. Next one is acidosis. If it is respiratory acidosis, CO2 will be high, but this time it's low, so it's not respiratory. If it's not respiratory, it's metabolic. So metabolic acidosis. Example, septic shock, DKA, or similar one. The last one is alkalosis. pH is high and PCO2 is high. So if it is alkalosis, if it is respiratory alkalosis, the person is breathing fast, CO2 should be low, but this time CO2 is high. So it means it's not respiratory, it is metabolic alkalosis, like vomiting. If the person is vomiting, it will be less acid, it will be high CO2. Shall I repeat it again, or is it good? All right. Asma Mokral.
still مكره.
Okay, make it short. You don't have to make it long.
Okay.
Introduce yourself.
Okay, my name is Asmait. I live here in America. I think there are arterial blood gas, which is for the pH balance of which is found in our blood. So the blood which is taken from ulnar of our hands, then we go to the laboratory and it detects about the pH value of our body system. There are four kinds, which is we can divide it into two: respiratory and metabolic. When we said respiratory, it could be respiratory alkalosis or respiratory acidosis. When we say metabolic, it could be metabolic acidosis or metabolic alkalosis. When we come to respiratory acidosis, the pH value is high and the pH value high and the carbon dioxide also high. When we call when
So, hold on.
to remember, right?
Hold on. hold on.
የተሳሳትኩትን ላስተካክለው.
Okay, hold on.
Okay.
The blood is drawn in the radial artery, not
Okay.
ulnar.
Radial artery. Okay.
So do like in line. Do the first one, second one, third one, and fourth one.
Which is written in here?
Yeah.
Are you saying that about this one? Okay,
Yeah.
this one a little bit for me. Okay, can I say in my way? I think this one
Yes,
a little
you do
bit.
it in a way. You do it in a way,
Okay.
but
I remember that when it is respiratory.
okay. So because the first one is respiratory
acidosis.
Yes.
The second one is respiratory alkalosis, I think, because
Why?
the first one is respiratory acidosis because pH is 7.31 and the carbon dioxide is high. So if carbon dioxide is high, it could be respiratory acidosis.
Exactly.
This respiratory
what
acidosis is caused by COPD. Maybe because our carbon dioxide, it couldn't be out easily, so that is the cause.
Exactly.
COPD
How about
patients.
the next one?
The next one is pH 7, and the next one is it is respiratory. Yes, respiratory alkalosis because pH is high, carbon dioxide low. If it is respiratory, when we say respiratory, the pH and the carbon dioxide are opposite. When we come to mechanical, if we say the metabolic, the respiratory and the acid and the carbon dioxide are, if they are both gone down or both gone up. When we say metabolic, this is the easiest way to remember.
Okay. All right. That's very good. So I would like to do it in the way we are discussing than what the book say, because I'm trying to do it easier than the same direction, different direction, because when you are in the test, same direction, different direction, upside down, your brain will get confused. So it's better to understand in a physiologic way. Like the second line is it's alkalosis with low CO2. Means the person is breathing fast.
Yes.
Rather than saying same direction, different direction. Because when you are in the test, the world will spin around you and you'll get vertigo.
Okay.
All right, so that's good. So let's do the next one. Next one is
Is
the
him
urology
available?
part.
Oh,
Okay,
okay.
so urology. Thank you, Asmat. That was very good. The urology part we discussed before. The picture is very clean. It has a picture showing the liver, the kidney, the ureter, renal arteries, and all that. But during that day discussion, we talk about different things. So the number one is the urinary system. The doctor doing this type of specialty is called urologists. They take care of the kidney. They could remove the kidney. They put different procedures. They take out kidney stones. They do biopsy of the bladder. They take out the bladder. They do ileal conduits. They do a lot of things. But today we'll be reviewing it, some of the procedures, and I gave you a homework about each number. So number one will be a urologist, because the urologist take care of all that. Number two is a kidney. In the kidney, what do you remember a procedure? The kidney biopsy. Kidney biopsy is very important to know what is the reason for the kidney failure, because sometimes you may not know. It could be autoimmune disease. It could be medications like NSAID, gentamicin, vancomycin, those things. The next one is the renal pelvis. That's where they put nephrostomy. When the ureter is blocked, they put the tube and then it drains out through the skin in the lumbar area. Number four, if you take out the ureters to the skin and connect it with the small intestine, the urine can come out. It's called ileal conduit. Number five is the bladder. You will be asked many questions about continuous bladder irrigation. You'll be asked about bladder scan, Foley catheters, and all that. And next one is urethra. It's around it is a prostate, BPH. You'll be asked prostate hyperplasia, hypertrophy. And when there is pelvic incontinence, patient get pessaries. Pessaries is like a ring, gets in and pushes the ureter, so the urine flow could be adjusted, and it helps from incontinence. That is number 6. Number 7 is the adrenal glands. We talk about adrenal gland during the endocrine part. So it's a reason for Cushing syndrome, Cone syndrome, Addison disease. Addison disease is like when it's not working. The next one is 8. When blood pressure is very uncontrolled, it could be from renal artery stenosis. Patients get stent. You will be asked on your test saying, oh, patient got renal artery stent, and you are watching the patient in the post-op area. And what do you report to the surgeon if blank? So the answer is, if it is blocked or get complicated, the person will have no urine. So if there's no urine, means there's a complication. And same thing with aortic aneurysm, number 10. Number 9, inferior vena cava. During pregnancy, when the uterus is big, it may be pushing it and blood pressure could be low. So what do you do? Because the inferior vena cava is on the right side, you have to put the patient to lie on the left side. Number 11, iliac arteries. What's the importance? during kidney transplant. That's where they put the kidney down. They may or they may not remove the original kidney, but they put the new kidney down in the pelvis. Number 12 is what? 12 is liver. Liver biopsy is known for significant bleeding. Post liver biopsy, you have to watch out for bleeding. Before the biopsy, it's your responsibility to check platelet count, PT, INR, and all that. You don't have to do the surgery, but you are the one making sure blood test is done. And after the procedure, you have to make sure they are not bleeding. If they are bleeding, they will have low blood pressure, tachycardia, and all that. And next one is 14 is pelvic bones. Pelvic fracture is known, like it does not need surgery most of the time. That's very important. Number 13, constipation. In the Western world, constipation is a big deal because they eat refined food. The food does not come out on time. Normally, if it is in Ethiopia, you eat the food, comes out in 3 days. In the United States, it may take 7 days to come out. So it gets harder, drier. Constipation is a big deal. Admitted patients, they may be on 3 or more medication to move their bowels. Bisacodyl, Miralax, Senna, milk of magnesia, lactulose, enema. How to do enema? Do you make it fast or slow? If it is slow, it doesn't work. If it is fast, it gives spasm. You have to do it a little bit in between. Any question on this? All right, so last time Tigist answered all these questions. I will give the question back to her. So Tigist will tell me each procedure or each name for each number. Okay, go ahead.
Number 1 is your urinary system. Procedures like
No,
ileal conduits.
Okay, no. Urologist. Number 1 is urologist. Ileal conduit is
Okay.
number 4.
Okay, sorry.
Number
2 is kidney. Kidney biopsy.
Okay, number 3.
Renal pelvis, nephrostomy.
Okay, just say only the procedure. Okay, number 4.
Ureter.
What
Can
procedure?
I add procedure? Ileal conduit.
Good. 5.
Bladder, cystoscopy, bladder scan, Foley catheters,
Very good.
NCBI.
6.
For number 6, urethra, BPH, pelvic incontinence.
7.
For number 7, adrenal gland. There are problems like Cushing syndrome, Cone syndrome, Addison disease.
What is Cushing syndrome?
የሆነ የሚያጎብጥ አይነት ነው።
High cortisol.
High cortisol. Yeah.
How about Cone syndrome? High aldosterone, so the blood pressure will be high. Cushing syndrome, high cortisol, the person will be obese. How about Addison disease?
I didn't remember.
Addison disease is low hormone. So when the hormone is low, because low cortisol, they get low glucose. Because of low aldosterone, they will have low blood pressure and low sodium, but high potassium. Okay, next one.
Renal artery and renal vein. Stent.
Okay, 9.
inferior vena cava. During pregnancy, the patient will lie on left side
Why?
because inferior vena cava is on the right side. So
Exactly.
if-
Good job.
if
Okay,
she-
10.
abdominal aorta.
So what procedure?
I don't know.
There are so many questions on UWorld about aortic aneurysm repair. Post-op, you need to follow up on that, because if the person gets acute oliguric renal failure, it's a sign that it's getting complicated. It's pushing into the renal arteries, and all that's one of the priorities. 11.
Common iliac vein and common iliac artery.
Procedure.
Mm,
Kidney
I don't
transplant.
Okay.
That's where they put the kidney in. So when you do exam or something, you may touch the transplanted kidney. It's just superficial. You could feel the transplanted kidney. How about 12?
12 liver. Liver biopsy, liver transplantation.
Why do you care about bleeding in the liver? Because there's no muscle. It has no muscle. So
Yes,
there's no
gotcha.
contraction. If it bleeds, there's no contracting muscle to stop the bleeding. How about the next one? 13.
Sigmoid colon. Colostomy, constipation is a big problem.
Good. Sometimes constipation could be so bad that it blocks the urethra. It's called obstipation. So it could be really bad. Okay, next one.
Pelvic bone, pelvic fracture is a problem.
Very good. Just had to guess. So next one is hyperkalemia. I know it's a medical thing, but you should know about this. Potassium is very important in the conduction system. Low potassium, high potassium affects the heart. Potassium could be high from many things, including medications like lisinopril, spironolactone, or renal failure. When the potassium is up, so many changes on the EKG. T wave could be tall, PR could be longer, QRS could be wide, whatever it is. If the heart is affected by hyperkalemia, you have to give calcium gluconate to stabilize the heart. Otherwise, the person may die. Otherwise, if there's no EKG change, medications that cause diarrhea like sodium polysterase or Caxilate, Veltassa, glucose with insulin, Lasix, or dialysis can be given. All right. If you have any questions, stop me anytime. Next one on the review is about eye. The eye has many things, but I'll go through each part and then I'll go to a little bit of disease process. So one of them is the lacrimal gland. Lacrimal gland produces the tears. It is on the lateral side of the eyebrow. If there's any problem with it, the eye will be dry. One example is Sjogren's disease. It's in the immunology part. Sjogren's disease can give dry eye, can give dry mouth. All right. If the conjunctiva is affected, it's called conjunctivitis. Sometimes it could bleed easily. It's called subconjunctival hemorrhage. It's not a big deal. It looks so red, scary, but it's not a big deal. Next one is the cornea. The cornea is a glassy, transparent front part. It's very important because it has no many layers, especially the superficial layer is so thin. If you leave it open to air, like in comatose patient or exophthalmos from hyperthyroidism, or like stroke patients with difficulty closing the eye could get scarred, could be opaque. It does not heal back if it stays longer. So what's the treatment? Corneal transplant. Sometimes they could slip down into different directions to correct vision. It's called LASIK, LASIK. Next one is lens. The lens is one behind the aqueous humor. When people get older, like 35-year-old, 40, 45, it gets stiff and they cannot see, especially when it's closed, so they cannot read. It's called presbyopia. They need reading glass. When they get very old, 70-year-old or more, or around that area, it gets white. It's called cataract. What do? They take out the inside and put artificial lens inside. It's called intraocular lens implantation. Behind is the aqueous humor, the fluid. Sometimes the retinal parts can detach and float inside. It's called floaters. We also talk about glaucoma. Glaucoma is a problem in the fluid pressure in front of the lens. But when the pressure is high, it could push back, so it can affect the retina and people could get blind. Optic nerve could be affected by glaucoma. It could be affected by multiple sclerosis. Any question on this? All right, next one on the slide is arthropathy. The most deformed joint is rheumatoid arthritis, and the one on the right side is podagra. It's called gout. So make sure just by looking into the picture, you can also guess what it could be. We discussed about hip replacement. Hip could be replaced because of fracture or degenerative disease for severe pain. The replacement could be partial, so only the head of the femur could be changed, or the socket or the acetabulum of the pelvic bone could be changed. It's called total hip replacement. This type of procedures are very common. I may have like 10 patients right now with hip replacements. It's very important to know because in the first 4 or 5 weeks, they are not working much. They could get blood clot. They could get pulmonary embolism, DVT, infection. So it's very important to know. It will come on your test. Before the procedure, after fracture, there are different types of tractions. One of them is called back traction. You have to know what they look like. Next one is on the GI. So in the GI, if you see the picture, almost every part of the GI system is there. Looking into the esophagus. Esophagus is very important for your test because there are many drugs that cause esophagitis. Doxycycline, alendronate, you'll be asked what to do to prevent esophagitis. The person should be sitting up straight, lots of water, no lying down for 1 hour, no food right after, and all that. NSAIDs, Melat was asked about this question last month on the test. It's bad for the stomach, it's bad for the kidneys. Alcohol is bad for pancreas. Smoking is bad for pancreatitis. You will be asked about what to do before the procedure for endoscopy, colonoscopy, you'll be asked about how to do a small bowel follow through x-rays, which is an x-ray that will be done like every 5-10 minutes for 2 hours and all that. You'll be asked about ERCP. It's an endoscope where the camera goes down from the mouth, esophagus, stomach, duodenum, and then get into the holes called ampulla of Vater through the pancreas and go up to the common bile duct to look for lesions for biopsy or to remove gallbladder stones. Next one is colonoscopy. You have to know it's very important after age 45. Many people need to be, almost everyone should be looked at for colon cancer, colon polyp. You will be asked what is the preparation, when to stop eating, when to do clear liquid diet, when to take that cleansing, go lightly. So all that you should know. You have to know what it is, how to do it. H. pylori infection is very common. Many people, friends of mine, called me from different places for symptoms. I suggested them to be tested for H. pylori. They benefited from it. You should know it. It's treated with antibiotic when somebody has bad gastritis, peptic ulcer disease. Without antibiotic, they will not get better. So H. pylori infection, you have to know about that one. The next one is colonoscopy, colostomy care. When you look at it, the color should be pink and moist. But if it is dusky or dark, no, it's not good. I suggest you guys to read the book Cutting for Stone. It's a book about twin brothers born in Ethiopia, and they went to the United States, and one of them has liver failure, and the twin was giving a transplant. So it's a very good book written by Abraham Verghese. He's an Indian guy born in Ethiopia. He was in medical school with Meles Zenawi in 1973. It's a very interesting story about liver transplant. Partly fiction, partly true. Next one is JP drain, NG tube care, and all that. All right. So, any question so far on NG tube? You will be asked that you have to mark at what centimeters the tip is, and make sure every day when you check it, it should not get longer and longer because it may come out by itself. So it's part of the nursing responsibility. You have to know how to damp and put the vacuum for JP drain, Jackson Pratt drain for abscess. So the next one is about learning English. As I told you before, it's very important to speak English because Nclex comes in English. If you work in the United States, it's all in English. You have to know history and culture and some common understanding to discuss with patients. So one of the questions I posted was about the history of America. How did people from another continent get into the United States? All right, so the question goes to whoever want to answer. Anyone interested to try? Aba Gazai. Aba Gifty. Third dose. ሲሆን አሁንም ዮሴፍም ጠፍቷል። How about Tigist? How did people got into the United States? 16,000 years ago, there was no plane. There was no Ethiopian Airlines that time. All right, so what it says is, if you look into the map behind the world, the United States by Alaska and Asia by Cambodia, China is very close. So during the winter season, the ocean freezes and people can walk on it or sled through it. So that was the answer. Next one is about blood cells. We discussed during hematology. You'll be asked about INR, checking for warfarin use. You'll be asked on how to manage heparin drip by following PTT when it's high, when it's low. And you'll be asked different questions on what should be the rate of drip, depending on the weight of the patient and the diagnosis. Make sure you review on that. You'll be asked on Lovenox injection. Lovenox injection comes in a pre-filled syringe. It has air inside. You should not remove the air because the air stays behind and helps to push out all the Lovenox inside the syringe. So you should not remove the air in the Lovenox. We discuss about red blood cells for anemia, polycythemia. When the hematocrit is high, it's called polycythemia. The blood gets thick, they are high risk for clotting. We discuss about platelets. When it's low, it's called thrombocytopenia. Different things like ITP, heparin-induced thrombocytopenia, or TTP. So you need to review on those things. WBC, neutrophils are important for bacterial infection, lymphocytes for signs of viral or tuberculosis, basophils and mast cells are involved during allergy. Next question is, so the next one was lymphedema, edema, DVT. If one leg is more swollen than the other one, you have to make sure it's not DVT or deep venous thrombosis. So the next one is about learning English. I posted about a love story and wisdom in an African village. So the king was mad on his wife and he told her to take away everything that belongs to you, but I don't want to see you in the morning. So what did she took home that night? Anybody interested to answer? You don't have to introduce yourself, just answer the question. Hello, Samal?
ይሰማል።
Okay, do you want to try the guest?
አላየሁትም።
All right, so it will be a homework. All right, so the next one is respiratory. We talk about CT scan of the chest. We talk about peak flow for asthma. It's your responsibility to know if it is in the green zone, a yellow zone, red zone, all that. And the other one was about the Animal Farm movie. Anybody who saw it? All right. So next one is the expected date of delivery. The menstruation was between February 1 and February 5. So when will be the expected date of delivery?
November 8, 2023.
All right, that's good. So that's 9 months and 7 days. Okay, so the important thing you need to remember is the New Year changes in January. So if it starts in September, the year changes. Like if it was between October and October and July, you have to make sure you change the year, because in Ethiopia the year does not change, but in the Gregorian calendar the year changes. So just knowing the date by itself doesn't make sense, because you know the month and the date, but you have to make sure the year is also aligned to the Gregorian calendar, because the year changes between December and January. All right, so I think that's all I have. Any question? All right, as a homework, I would like you to learn English, because it's very, very important. It's easy to pass the Nclex, but the language is very important. The easiest way is to do the videos what I've been posting. They're very easy, it's like 10-15 minutes. That would be your lifesaver. I don't think the Nclex will be hard. I think the language will be a problem. Being said, thank you for attending today's session. This will be the end of today. Next session will be Wednesday, June 14, same time. Text will be presenting obstetrics and gynecology. See you then. Thank you, and have a good day.